Hello everyone, we are Team Line. Our project is Health Monitor System. Here is all the content we want to cover in this presentation. In our background research session, we found that there is an upward trend in aging population scale. There are over 40% of the elderly people are living alone in Australia. That proportion in US is 29%. This range is even higher in some Asian countries. A study shows that 2 in 3 genetic nursing home residents are suffering from chronic pain, but in half of the cases, it was not detected by the treating physicians. And to learn more about the elderly people's attitude towards this kind of system, we concluded some survey in the later parts. The system is mainly designed for the elderly people. They can get an online diagnosis service without going out. When emergency happens, the system can even send the alert. Also, the online clinic can reduce the pressure on the healthcare system. In addition, the guideline can get to know the health condition of the elderly people all the time. Differences between the three stakeholders mentioned. The healthcare worker is not involved in this system. The responsibility of them is just help the elderly people to get a conversation understanding of the medical report that they get. They need to visit the user regularly when necessary. They need to accompany their users. Initially, the solution is a health data monitoring system. Users have the ability to customize what service they want to get. And when the data is up to threshold, then it will trigger the alarm system. Also, the system will provide an online diagnosis service. The logic of the system function has been described in this figure.
The interaction paradigm is the mobile and wearable devices and the window icon menu and pointer. For users, this is a system that can be used to load data, and for doctors, they need to use computer to do the data analysis and online services. As for the interaction mode, it's a combination of conversing and instructing, because the function can be achieved through many ways such as touching screen and clicking the start button. And the initial design requirement is the safety and security, because the system will involve personal privacy and should be able to summarize health data analysis together. Based on the project plan we set during 3 iterations, the team has done a lot of activities in order to confirm the system is feasible. Firstly, we have done some literature reviews, such as healthcare demands, reliability of the system, and social impact. We have also done some research on current or past solutions for the topic. In addition, the team also distributes different questionnaires to our 3 types of stakeholders via different channels, aiming to understand their needs and concerns. Lastly, we carry out a semi-structured interview with the elderly people by using the prototypes, analyzing users so that we can determine which function we need or not. We are facing 2 main problems during the design process. One is that when we collect user health information, which is very sensitive, users may raise concern about the security of their data and are unwilling to use it. To solve this problem, we give the right to user to decide whether to upload the data or just to keep it locally, upload whenever they need it. The other problem is we find that some elderly people may resist using the high technology products. We solve this by designing easier functions and using multiple operation methods such as screen gesture, voice control, and physical buttons. And for the future improvement, mental health is also important for the elderly people. We can focus on this area, building more functions like online communities or game suites for the elderly people. So that's all I want to talk about. Thank you.